Hi, everyone. My name is Brian Nichols. I'm with Robinson and Cole, and I'm one of the co-chairs of the Emerging Issues in Healthcare Law Conference this year.
Hi, and I'm Matt Fisher. I'm the other co-chair along with Brian, and I'm with Myrick O'Connell in Westborough, Massachusetts.
So we're really excited about this year's EMI conference. We are back in San Diego at the Manchester Grand Hyatt. It's March 11th through the 14th, so it's right around the corner. Consistent with the section chair's real key theme of innovation this year, we really wanted to focus on the emerging part of EMI, the emerging issues. So this year, you'll still get your CLE, you still have all the opportunities to meet with folks and see all the folks that you haven't seen in a while. But in addition, we've added a couple of new features this year. Really two of the things that we're most excited about are the disruption panels that we've added. So these would be non-sort of CLE events, but we're going to have a panel of folks that are disrupting the healthcare industry, and they are innovating, and they're going to change the way that healthcare is delivered, healthcare is consumed in the future. So that will be on Friday morning, and on Wednesday afternoon, we will have our disruption in the legal industry panel. So we've got folks who are going to be talking about the future of legal services, how legal services will be delivered, how artificial intelligence will help us do our jobs. So these two panels, I think, are going to be really sort of interesting and must-see panels, and we're really sort of excited about it. Matt?
Yeah, and on top of those innovation panels, we still have the normal CLE coverage of different topical areas within health law. And what I always find very helpful at EMI is it takes a very practical perspective on things. It's not just theoretical, but it's actually diving into what's actually happening out there in the industry and gives you a lot to think about and a lot of takeaways to bring back to your practice. And then the other piece that we're also really excited about is the further integration of a service project into EMI. Last year when we were in Florida, we had a table that people could stop by and fill a bag. This year, we're actually making it a full-on event where we're going to get people in groups around tables to be able to assemble kits that will be delivered to children in local San Diego hospitals to be able to help make their stay there a little bit more enjoyable. And while providing that community benefit, it'll also give everyone a chance to interact and network, which also kind of leads into the other great part of attending EMI, which is all the connections that you can make. That's what's kept me coming back for a decade at this point. Right from the start, you get brought in. Everyone is always more than willing to chat and talk with you about not just their practice, but the health law section, really anything that could be of interest. So with all of that that's going on and all the excitement there, we are really looking forward to having you join us in San Diego in March.